Understanding symmetry in relationships can help improve things with your spouse, but also help you with your parenting. I'm Dr. Matthew Thornton. I'm a licensed marriage and family therapist and a licensed professional counselor, and I want to teach you concepts and strategies to help you change your life and improve your relationships. I want to teach you the concept of symmetry in relationships. Well, you may remember from geometry class back in high school that a symmetrical shape is one that matches on one side and the other. And the same thing is true in relationships. Relationships that sort of match each other are considered symmetrical. So let me give you an example of that. If my wife gets some really great news and I get super excited with her, then I'm sort of matching her excitement and intensity, then that is a symmetrical relationship. Now, relationships can either be classified as symmetrical or complementary. Now, in that same scenario, if my wife gets some really excited news and she's really pumped up about it, and I'm sort of Debbie Downer and kind of bringing things down, then that would be considered complementary. Now, complementary relationships can sometimes look like closeness and distance as well. The same thing with symmetrical relationships, but a complementary relationship where that one is pursuing the other and the other is pulling away. You can see this in romantic relationships, but also in parenting relationships as well. That classic pursuer and withdrawer, that's considered a complementary relationship. Now, these different shapes of relationship, whether they're symmetrical or they're complementary, tend to serve a function for us. And a lot of times it can be really useful. Let's say I got some really bad news about a loss that I've had in my life. If my wife comes in and she matches me in that, meets me in my grief and my loss, I feel heard and understood. And we're in that symmetrical relationship together, and that serves a function for us. The same thing goes with complementary. If, say, one of my kids acts a fool and I get really upset and I want to sort of fly off the handle, and my wife says, hold up, maybe we need to think about this differently. It serves a function to help regulate me so that I parent appropriately. So complementary or symmetrical relationships oftentimes serve a function for us. It's not a bad thing at all, either one. What gets us in trouble, however, is when we become rigidly stuck in one of those shapes or the other. Naturally, in relationships, we should be oscillating or going back and forth between symmetrical or complementary based on what is most helpful in that moment. But if we get stuck in one particular pattern, that can be a problem. Now, say symmetrically, if we're upset with one another and I get upset and then you get upset and then I get upset and then you get upset even more, then we're in what's called a symmetrical escalation. And that's when relationships can get really explosive. And so that can be really problematic. The same thing with complementary relationships that are rigidly complementary. You can create a lot of distance in a relationship. Say you're in that pursuer and withdrawer situation where one is really after the other and trying to pursue closeness and wanting to talk through things, and the other one just keeps pulling further and further away. And so when you're rigidly stuck in one or the other, that's when problems can really happen. So how can this help you? Well, the first thing I want you to be able to do is recognize whether or not you're in a symmetrical or complementary sort of relationship. And then to see whether or not you're rigidly stuck in that pattern in your relationship. Now, if you're oscillating back and forth, or sometimes you kind of get stuck a little bit in one pattern or the other, that's okay. That's a natural part of just being a human being. But if you're constantly stuck in one particular pattern, or things are getting really out of hand, say you're in that symmetrical escalation with your spouse and things get really explosive and the arguments are really, really rough. Or you're in that pursuer and withdrawer type of relationship and things just keep pulling further and further apart. So once you've sort of identified what type of relationship that you're in, then comes the difficult work. Now, you being the one that's observed this, in the moment, the thing that you've got to do is try to change your tactic. If you're in that symmetrical escalation with your spouse where things are getting heated, you have to take it on yourself when you recognize that you're in that symmetrical escalation to try to slow your pacing and your bring down the intensity of that interaction as best you can. I will caution you against trying to teach your spouse in the moment that you're in some sort of symmetrical escalation. That's not going to go well. Later on, after things calm down, you can sit down together. And that's when I would say, if you're in a symmetrical or complementary sort of situation where you're rigidly stuck there, when things are calmer or when the relationship's a little smoother, sit down together and sort of talk through that pattern. With both of you understanding that you're in those type of relationships, you might be able to change your tactics a little bit, or at least provide a little bit of less intensity. Now, what you hope for in that symmetrical escalation is, as you kind of calm things down, that your spouse will also come down with you so things don't get too explosive. Or if you're in that complementary relationship where you've been maybe the pursuer in the relationship and your spouse has been pulling away from you, or your child has been pulling away from you, if you can kind of change tactics in that, give them a little bit of space. And it's not because you don't want that closeness in the relationship or you don't value that relationship. What you're trying to do is breathe a little oxygen into that pattern to where they can ease up from their withdrawing and kind of move towards you. And if you've been the withdrawer in the relationship, I would really encourage you to take a step towards that other person, whether that be just initiating a conversation, asking them out on a date. That's going to help ease up some of that pursuing that you've been feeling. If you've been feeling pressed in on, taking a step towards your spouse may actually be the thing that's going to ease some of that pressure. So I hope these concepts are helpful to you. The thing to do, again, is to recognize what kind of pattern you're in, determine whether or not you're in a rigid sort of stuckness in that particular pattern, whether that's symmetrical or complementary. And for you, being the person that's trying to change your life, changing your tactics in the moment the best you can to try to ease things up. And then later on, follow up with a conversation about how you see this pattern in y'all's relationship and how you want to change it. So I hope that this has been helpful to you. Now, if you're a mental health professional and you want to learn more about this particular concept of symmetry and complementarity in relationships, it comes from Don Jackson's conjoint family therapy and is also based on the work of anthropologist Gregory Bateson. Great theories and concepts to look at, and I would encourage you to learn this particular approach to be able to use it in your counseling. Now, if you're struggling with a mental health concern, I would urge you to reach out to a mental health counselor. Sometimes it can be really hard to identify what's happening in your relationships and in your life, and a mental health counselor can help walk you through a process of determining what type of relationship you're in and the strategies best suited to help change that relationship. We know that mental health counseling works, but it takes you reaching out in order for us to be able to help you. So again, I'm Dr. Matthew Thornton. Go out and make a difference in your life.